How are you feeling today? Great. That's just great.
This is not my standard greeting, I assure you. I tend towards something a little more formal, a little less inquisitive, such as say, hello. But it is the standard greeting here. There is some debate as to the correct response to this salutation. Should one say, I feel good, using the copulative feel to link the subject I to the subjective complement good, or I feel well, using an adverb to modify the subject's state of being? I don't know. I am a professor of 17th century poetry, specializing in the holy sonnets of John Donne. So I just say, fine. Of course, it is not very often that I do feel fine. I have been asked, how are you feeling today? As I was throwing up in a plastic wash basin. I have been asked as I was emerging from a 4-hour operation with tubes sticking out of every orifice. How are you feeling today? I am waiting for the moment that someone asks me that question and I am dead. And I'm a little sorry I missed that. It is unfortunate that this remarkable line of inquiry has come to me so late in my career. I could have exploited its feigned solicitude to great advantage, as I was distributing the final examination to my graduate course in 17th century textual criticism. Hi, how are you feeling? Of course, I'm not be wearing this costume, so the question's ironic significance would not be fully apparent. As I trust it is now. Irony is a literary device that will be deployed to great effect. I ardently wish this were not so. I would prefer a play about me be cast in a more mythic, heroic, pastoral mode, but the facts, primarily stage 4 metastatic ovarian cancer, conspire against that. With Fairy Queen, this is not. And I was dismayed to find that my play would contain some elements of humor. I have been at best an unwitting accomplice. It is not my intention to give away the plot, but I think I die at the end. They have given me less than 2 hours. If I was poetically inclined, I would employ a threadbare metaphor about the sands of time slipping through the hourglass, the 2-hour glass. Now our sands are almost run, more than a little and undone. Shakespeare, I trust the name is familiar. However, as of late, I've been a little disinclined towards poetry. I've got less than 2 hours. Then, curtain. I'll never forget when I found out I had cancer. Someday, you have cancer. See? Unforgettable. It came as something of a shock. I had to sit down.
Please sit down, Ms. Barron. You have advanced metastatic ovarian cancer. Go on. You were a professor, Ms. Barron?
Like yourself, Dr. Kelekian.
Oh, yes. Now then, you presented with the growth that unfortunately went undetected in stages 1, 2, and 3. Now it's an insidious.
Insidious.
Insidious means undetectable.
Insidious means treacherous. Right.
Shall I go on?
By all means. Good.
In invasive
Insidious.
carcinoma,
Curious word
the most
choice.
effective treatment
Cancer, cancel. By
cancer,
cancer,
developing of certain bodies designed to target the ovarian. With a hard excessive stage 3 and above. Ms. Barron? Am I going too fast?
No.
Good. You'll be hospitalized.
Let's do some reading about cancer.
Symbols,
Some books, articles, bibliography.
for 3 days after each treatment, monitor kidney function. Is anyone doing any research on cancer? We'll have another diet test.
Awesome.
The antineoplastic will
Antineoplastic, SI against the antineoplastic mold, this mold.
and the hair follicles.
Hair follicles.
We will of course rely on your resolve.
My
Deal with some
resolve.
more pernicious.
Pernicious, that's
Karen?
Yes.
Do you have any questions so far?
No, you're being very thorough.
I understand that some of these terms are new.
No, you are being very thorough.
Yeah. I make a point of it with my students.
So do I. Thoroughness, I tell my students, but they seem constitutionally averse to painstaking work.
Yours too.
Oh, it's worse every year.
This is not dermatology, for Christ's sake. This is medical oncology.
My students read through a text once, and think it's time for a break.
Minor blind.
Mine are deaf,
You just have to help, I suppose.
I suppose.
Where were we, Miss Ray?
I believe I was being thoroughly diagnosed.
Right. Now, the tumor is spreading very quickly, and this treatment is very aggressive. So far, so good?
Yes.
Better not teach next semester.
Out of the question.
The first week of each cycle, you'll be hospitalized for chemotherapy. The next week, you may feel a little tired. The next week, you'll be fine relatively. This cycle will repeat 8 times, as I said before.
8 months like that.
8 months like that. This treatment is the strongest thing we have to offer you. And as research goes, it would make quite a contribution to our knowledge.
Knowledge. Yes.
Here's the informed consent form. Should you agree, sign there at the bottom. Is there any family member you'd like me to explain any of this to?
That will not be necessary.
Yeah. The important thing is for you to take the full dose of chemotherapy. There may be times when you wish for lesser doses due to the side effects, but we've got to go for force. The experimental phase is happening. We've got to have the maximum dose to any. Is there?
Yes.
I need you to be very tough. Do you think you can be very tough?
You needn't worry. I feel like I should have asked more questions because I know there's going to be a test. I have cancer. Insidious cancer. With pernicious side effects. No. The treatment has pernicious side effects. I have stage 4 metastatic ovarian cancer. There is no stage 5. Oh, and I'm going to have to be very tough. It seems to be, as the saying goes, a matter of life and death. I know all about life and death. I am a scholar of Donne's holy sonnets, which explore mortality in greater depth than any other piece in the English language. And I know for a fact I am tough, uncompromising, a demanding professor, never one to turn from a challenge. That's why I, while a student of the great E.M. Ashford, chose to study Donne. Professor Ashford!
Do it again.
It came as something of a shock. I had to sit down.
Please sit down. Your essay on Holy Sonnet 6 is melodrama, with a veneer of scholarship unworthy of you, to say nothing of doubt. Do it again. You must begin with a text, Miss Barry, not with a feeling. Death be not proud, though some have called thee, mighty and dreadful, for thou art not so. You have entirely missed the point of the poem, because I must tell you, you have used an edition of the text that is inauthentically punctuated. In the Gardner edition,
That edition was checked out of the library.
Miss Barry.
Sorry.
You take this too lightly, Miss Barry. This is metaphysical poetry. not the modern novel. The standards of scholarship and critical reading, which one would apply to any other text, are simply insufficient. Do you think the punctuation of the last lines of this sonnet are merely an insignificant detail? The sonnet begins with a valiant struggle with death, calling on all forces of intellect and drama to vanquish the enemy. But it is ultimately about overcoming the seemingly insuperable barriers between life, death, and eternal life. In the edition you chose, this profoundly simple meaning is sacrificed to hysterical punctuation. And death, capital D, shall be no more, semicolon. Death, capital D, comma, thou shalt die, exclamation point. If you go in for this sort of thing, I suggest you take up Shakespeare. The Gardner edition of the Holy Sonnets returns to the Westmoreland manuscript source of 1610. Not for sentimental reasons, I assure you, but because Helen Gardner is a scholar. It reads, and death shall be no more, comma, death thou shalt die. Nothing but a breath, a comma, separates life from death everlasting. It's very simple, really. With the original punctuation restored, death is no longer something to act on the stage with exclamation points. It's a comma, a pause. This way, the uncompromising way, one learns something from the poem, wouldn't you say? Life, death, soul, God, past, present, not insuperable barriers, not semicolons, just a comma.
Life, death. I see. It's metaphysical conceit. It's wit. I'll go back to the library and I'll rewrite the paper.
It is not wit, Miss Barry. It is truth. The paper's not wit.
It isn't.
Vivian, you're a bright young woman. Use your intelligence. Don't go back to the library. Go out. Enjoy yourself with friends.
I went outside. The sun was shining brightly. There were students sitting on the lawn. They were laughing and talking about nothing. The inseparable barrier between one thing and another is just a comma. Simple human truth and compromising scholarly standards, they're connected. I couldn't. I went back to the library. All right. 8 cycles of chemotherapy. Give me the full dose. The full dose every time. The attention was flattering for the first 5 minutes. Now I know how a poem feels.
Name?
Vivian Baring.
Uh-huh.
Baring. B-E-A-R-I-N-G. Vivian. V-I-V-I-A.
Doctor?
Yes, I have a PhD.
No, you're a doctor.
Oh. My doctor is Kelekian.
All right. We're just gonna take some x-rays.
I am a doctor in philosophy.
Take a deep breath in and hold it.
I am a scholar of 17th century poetry.
Now turn on your back and hands behind your head.
I have made countless distinctions in the discipline of modern English literature. I am, in short, a force.
Name?
Lucy, Countess of Bedford.
I don't see it here.
Bearing, Bearing. My doctor is Kelekian.
Okay.
After an outstanding undergraduate career, I studied with Professor Ashford for 3 years, during which time I learned by instruction and example what it means to be a scholar of distinction. As her research fellow, my primary task was the alphabetization of index cards for Ashford's monumental critical edition of Donne's sonnet, Devotion Upon Emergent Occasion. I am thanked in the preface, Miss Vivian Baring, for her able assistance. My dissertation, Ejaculations in 17th Century Manuscript and Printed Edition of the 12 Holy Sonnets, a Comparison, was revised for publication for the Journal of English Texts, a prestigious venue for a first appearance.
Where's your wheelchair?
I don't know, I was busy just now.
Well, how are you gonna get out of here?
I don't know. Perhaps you would like me to stay.
I guess I gotta go find you a chair.
Don't inconvenience yourself on my behalf. My second article, A Classic Explication of Donne's sonnet Death Be Not Proud, was published in Critical Discourse. The success of the essay prompted the university press to solicit a volume in the 1633 edition of the 12 Holy Sonnets, which I produced in the remarkably short span of 3 years. My book, entitled Made Cunningly, remains an immense success in paper as well as in cloth. In it, I devote each chapter to one sonnet, examining each word in extensive detail. I provide past interpretation and my own analyses. It is exhaustive. Bearing, my doctor is Kelekian.
All right. Just lay here for a moment.
For how long?
Just a little while.
The scholarly study of poetic texts requires a capacity for scrupulously detailed examination, particularly with the poetry of John Donne. The salient characteristic is wit. Itchy outbreaks of far-fetched wit, as Donne himself once said. For the average reader, that is to say, the student with the B+ or better average grade, wit is a way to sharpen mental faculties, to experience the flash of comprehension that can only follow hours of exacting and seemingly pointless scrutiny. scholar. To the mind well-versed in 17th century vocabulary, versification, and theological, political, historical, geographical, and mythological allusions, wit is a way to see how good you really are. After 20 years, I can say with confidence, there is no one quite as good as I.
Susie?
Yeah.
Ready when you are.
Okay. Miss Baring, this is Dr. Jason Posner. He's going to be doing a history, asking a bunch of questions. He's Dr. Kelekian's fellow.
Hi, Professor Grant. My name's Dr. Jason Posner, clinical fellow, medical oncology branch under Dr. Kelekian. I actually had you at the U. I took your course in 17th century poetry.
Were you an English major?
No, biochemistry, but you can't get into med school unless you're really well-rounded. And of course, I made a bet with myself that I can get an A in the hardest course on campus.
How'd you do, Jace?
Success!
Really?
I got an A-, but it was a really hard course, and I'll just call it okay.
Yeah.
Here, I'll just put this. Okay. Proxemics. Okay. Good. Just keep breathing. Okay. I'm going to be taking your history. It's just like a medical interview. I'll give you an exam after.
I believe Dr. Kelekian has already taken that.
Well, I know that, but he wants me to do it too. So just let me take a few notes as we go.
Very well.
Okay. Let's get started. How are you feeling today?
Fine.
That's great. How's your general health?
Fine.
Excellent. Okay. We know you are an academic.
Yes, we've established that.
So we don't need to talk about your interesting work.
No.
How old are you?
50.
Are you married?
No.
Your parents living?
No.
How and when did they die?
My father quickly when I was 21 of a heart attack. My mother slowly when I was 41 and 42 of cancer. Breast cancer.
Cancer.
Breast cancer.
Any siblings?
No.
You have any questions so far?
Not so far.
Okay. Do you drink caffeinated beverages?
Yes.
Which ones?
Coffee.
How many though?
Once a day. Let's say 2 to 5. There's something that's moderate.
Okay. How often do you undergo routine medical checkups?
Not as often as I should, but I've been feeling fine. I really have.
So the answer is...
35 years.
What do you do for exercise?
I'm pace.
Are you having sexual relations?
Not at the moment.
Pre or postmenopausal?
I'm free.
Okay, when was the first day of your last period?
10 days, 2 weeks ago.
I see. And when did you first notice your present complaint?
This one now?
Yes.
Well, I'd say it was about 4 months ago. Like a cramp, but not the same. Kind of thing.
How did it feel?
Like a cramp.
But not the same?
No.
So what came next?
No, I started noticing my body more. Occasional pains, sharp pains.
What kind of pain?
Sharp pains. You know. I'd be tired, exhausted. I was working on a very prestigious entry for the Oxford Encyclopedia of English Literature. Well done. Quite an honor, but the deadline is very strict.
So you would say you were under stress?
Not any more than usual, but I couldn't withstand it this time, I don't know.
So
I went to Dr. Chin, my gynecologist, who then in turn sent me to the internist, who then in turn sent me to Dr. Kelekian, thinking I had a tumor.
And that's it?
Till now.
Well, that's very interesting. Okay, I guess I'll start the examination now. It's just going to be a few minutes. Just sort of just lying back and just relax. Okay? Just keep breathing. Just keep relaxing. Okay? It's not going to hurt. Breathe. Let me get my sheet. Okay, just stay calm. Okay. Okay. Yep, very good. Right, I have to get Susie. It's this crazy clinical rule. You gotta have a female here, right? Okay, I'm gonna be right back.
I wish I had given him an A. 2 times 1 is 2. 2 times 2 is 4. 2 times 3 is 6.
Susie?
Death be not proud, though some have called thee mighty and dreadful, for thou art not so. For those who thou thinkst thou dost overthrow, die not, poor death, nor yet canst thou kill me.
Has anybody seen Susie?
Thou art saved to fate, chance, kings, and desperate men, and in poison, war, and sickness dwell. And poppies or charms could make us sleep as well and better than thy stroke. Why slowest thou then?
Okay, she was just here a minute ago.
One short sleep past, we wake eternally, and death shall be no more. Comma, death thou shalt not.
Okay.
What is this? What did you...
I had to get you to come. Here, blanket there. I'll just get these gloves on. Okay, we're gonna begin, Professor Bernie. Just okay. Begin. So, Susie, isn't it interesting that I had Professor Barron as a teacher?
Yeah, I wish I had taken some poetry. I don't know anything about literature.
Yeah, well, Professor Barron was really highly regarded on campus, so of course it looked great on my transcript that I had taken her course. And they even asked me about it in my interview for med. Oh, Jesus! Oh.
What?
Anyway, 17th century poetry, John Donne, that metaphysical wit, that metaphysical poetry, it's the hardest course in the English department, but of course I did well. But, I mean, I'd like to see them try biochemistry, you know what I'm saying? Okay, I think we're done here. Okay, I gotta go.
There's one thing that can be said for an 8-month treatment course in cancer. It is highly educational. I am learning to suffer. Yes, it is mildly uncomfortable to receive an electrocardiogram, but the agony of a proctostigmoidoscopy sweeps it from memory. Yes, having to wear a nightgown all day is embarrassing, but it's a positive privilege compared to watching myself go bald. And yes, Having a former student give me a pelvic exam was thoroughly degrading. And I use the term deliberately. Compared to complete agony. Oh God. What's left? It's left. You may have remarked that my vocabulary has taken a turn for the Anglo-Saxon. Oh God. What a bark my brains out. Wonder what would actually happen if I did bark my brains out. It would be a great loss of my discipline. Not that a few of my colleagues would be relieved. Say nothing of my students. It's not that I'm controversial, just compromising. Word got out that Vivian had barked her brains out. Well, first my colleagues, many of whom are my former students, would scramble to my position. Then their consciences would kick in and they would honor my memory with a collection of their essays on John Donne. It would begin with a short chapter touching on my more redeeming qualities. It would be short. Published and perished. Watch this. I have to press this button to get someone to come and measure this thesis. They have to record my input and output. This counts as output.
Hi, Miss Barron. You having some nausea?
Yes.
Why don't I take that?
It's about 300 cc's.
Not all.
Very hard work.
Yep, 300. Good guess. Now, is there anything else I could get for you? Some jello or anything?
No, thank you.
Are you okay? All by yourself in here? Yes. You don't seem to be having very many visitors.
Oh, none to be discussed.
Right. That's what I thought. Is there anyone you'd like me to call?
That won't be necessary.
Okay. Kelekian and Jason should be around in a few minutes, but I'll pop in my head every once in a while, just to see how you're coming along. And if there's anything you need, just call.
Thank you.
Right. Just ring.
In this dramatic structure, you will see the more exciting parts of my tenure as an inpatient receiving experimental chemotherapy. However, as I am a scholar and impresario, I feel obliged to document the times in between the dramatic climaxes, in between the spectacles. In truth, it is more like this. It's amazing how time can be so still. It hangs, it lays, and yet there is so little of it. It goes by so quickly, and yet it is so scarce. If I were to write this scene, it would be 15 minutes long. I would lie here, you would sit there. Not to worry. Brevity is the soul of wit. And if you think it's tedious for the audience to receive 8 cycles of chemotherapy, imagine how it feels to play my part. All right. Friday morning, Ram rounds, and action. Jason?
Professor Baring, how are you feeling today?
Fine.
That's great. That's just great.
Grand rounds.
Early
The
detection.
term is there.
Stages of
Grand, not in the traditional sense of sweeping or magnificent. Rounds, not as in a musical canon or a round of applause. Although that would be a nice change of pace. No, round here seems to signify regarding around the main issue, which seems to be my struggle for life.
The testes are supposed to be.
Grand rounds is not grand opera, but it is positively dramatic compared to just lying there.
Full lymphatic impulse.
Pole of subservience, hierarchy, gratuitous
The
displays,
time of first surgery.
sublimated arguments.
Part of the tumor was
I feel right at home.
Mostly in this area.
It's like a graduate seminar, except for one major difference.
Right, ovaries.
I once did the teaching, now I am taught. They read me like a book.
Evidence of primary site shrinkage.
It's a little easier this way. I just sit here like cancerous. It requires less acting every time. Excellent command details.
Excellent command details.
They're talking.
Now,
Other complaints with Hexenberg.
Milo's.
Well, okay, first, of course, is the myelosuppression. Everybody knows that. It's a lowering of blood cell count. I mean, that kind of goes without saying. With this combination of agents, I can see that nephrotoxicity is released.
Keep going.
Okay, so the kidneys are designed to filter out impurities in the bloodstream. but in trying to filter out the chemotherapeutic agent in the bloodstream, they just shut down.
Intervention.
Hydration.
Monitoring.
I want full recording of fluid intake and output, as you see here on these graphs, to monitor daily hydration and kidney function. And I want these monitored by a clinical fellow as per the protocol.
Good. Anybody else? Side effects?
Nausea and vomiting.
Jason.
Routine.
Pain while urinating.
Routine.
Psychological depression.
No way.
Nothing else. Are there no other complaints with Hexam good? Come on.
Mouth sores.
Nothing.
Skin rash?
Nope.
Dr. Barron, why do we waste our time?
I do not know, Dr. Kelekian. Jesus, use your eyes! Hair loss.
Oh, that doesn't
Come fair.
Jason.
Hair loss after first sight.
That's better. Dr. Barron, full dose. Good job. Keep pushing the fluids. Thank you.
Thank you.
Jason.
Oh, right. Thank you, Professor Byrne. You've been very cooperative.
At times, this obsessively detailed examination seemed to me to be nefarious business. But on the other hand, what is the alternative? Ignorance? Ignorance may be bliss, but it's not a very noble goal. So I play my part. I receive chemotherapy, I throw up, I am subjected to countless indignities, I feel better, I go home. 8 cycles, 8 neat little strokes. Yes, there have been the usual variations, red herrings, some flops. Hepatotoxicity, liver poison, neuropathy, nerve death. They are medical terms. I look them up. It has always been my custom to treat words with respect. I remember when I first realized that words would be my life's work. It was my 5th birthday. I liked that story best. Read another one. I think I'll read the tale of the Flopsy Bunnies. The Tale of the Flopsy Bunnies by Beatrix Potter. It is said that the effect of eating too much lettuce is Mommy, what's that word? Sound it out. Soporific. Soporific? What does that mean? Soporific. Causing sleep. Causing sleep. Makes you sleepy. Makes you sleepy. Soporific means makes you sleepy. Correct. Soporific. Now, use it in a sentence. What has a soporific effect on you? Soporific effect on me. What makes you sleepy, honey? Nothing. Correct. What about you, Mommy? Oh, what has a soporific effect on me? Boring conversation, I suppose, after dinner. Me too. Boring conversation. Carry on. It is said that the effect of eating too much lettuce is soporific. The bunnies in the picture, they're sleeping because of soporific, just like you said. The image bore out the meaning of the word just as she explained it would. At the time, it seemed like magic. So imagine the effect John Donne's words had on me. It was like ratiocination, concatenation, coruscation, tergiversation. Medical terms are less evocative. However, I want to understand what the doctors mean when they anatomize me. I will admit that in this particular line of terminology, they possess a more potent arsenal than myself. My only defense is the acquisition of vocabulary.
When did it start?
I was at home. I called. They said to come in. They said fever and neutropenia.
You did the right thing to come in. Did you drive here?
Yeah, I took a taxi.
Okay. Just sit there. I'll get Jason. He's on call tonight. We'll get you some meds. I'll get you some juice. Some nice juice. With lots of ice.
The lights in my house, I left all the lights on.
Don't you worry. It's gonna be okay.
How are you feeling, Professor Brown?
My teeth are chattering.
Vitals?
Temp 39.4, pulse 120, respiration 36, chills and sweating.
Fever and neutropenia. It's a shake and bake. Blood cultures and nerve stack. Prepare for reverse isolation. Start with PCMF and on vitals every 4 hours.
Jason, I think you need to lower the dose for the next cycle. It's too much for her like this.
Lower the dose? No way. Come on. She's tough. I want her at the full dose every time. Come on.
Good morning, Dr. Baring. 5th cycle, full dose, definite progress. Is everything okay? Yes. You're doing swell. No problem. Couple of days, think of it as a vacation. Jason, did you wash?
Right.
In isolation, I am isolated. For once, I can use the term literally. The chemotherapeutic agents that are eradicating my cancer have also eradicated my immune system. Every living thing is a health hazard to me.
Really not got the time for this.
Especially doctors.
Okay, just look at I and O sheets for 1 minute, and it takes me 1 hour to do precautions. Let's see, 4, 7, 11, 2, twice, 3. Okay. Jesus, clinical. Professor Barron, how are you feeling today?
Fine.
Okay, IV's gonna kick in any time now, no problem. Listen, I gotta go, just keep pushing the fluids.
I am not in isolation because I have cancer. Because I have a tumor the size of a grapefruit. No, I am in isolation because I am being treated for cancer. My treatment imperils my health. Herein lies the paradox. John Diamond, the rebel. I would rather in it, if you were to write a poem about it. My students would flounder in it because paradox is too difficult to understand. Think of it as a puzzle. I call them an intellectual game. Or I would tell them if it were a game. But it's not. My students were here. If I were lecturing, how I could perplex them. Every shifting awareness, every ambiguity. Why I could draw so much from the poems. I could be so powerful. The poetry of the early 17th century, what is also known as the metaphysical school, considers an intractable mental puzzle by exercising the astounding human faculty of the time, namely wit. The greatest wit, and some would say the greatest English poet, was John Donne. Donne applied his capacious and agile wit to the greater experiences of the human life. Life, death, and God. In his poetry, metaphysical quandaries are addressed but never resolved. Ingenuity, virtuosity, and a vigorous intellect that jousts with the most exalted concepts. These are the tools of wit. If poisonous minerals, and if that tree, whose fruit through death on else immortal us, if lecherous goats, if serpents envious, cannot be damned, why should I be? And why should intent or reason born in me make sins else equal in me more heinous? And mercy, being both easy and glorious to God, in his stern wrath, why threatens he? But who am I to dispute with thee, O God, O, in thine only worthy blood, and my tears make a heavenly Lethean flood, and drown it in my sins' black memory. That thou remember them, some claim as debt. I think it mercy, if thou wilt forget. Aggressive intellect, pious melodrama, and a final fearful point. Donne's holy
Sonnet 5, 1609 from the Ashford edition based on Burn. The speaker of the sonnet is an intellectual, and he plays his part convincingly. But in the end, he finds God's forgiveness hard to believe. If arsenic and serpents cannot be damned, why should he be? By asking this question, he turns eternal damnation into an intellectual game. Why would God do what is hard to condemn, rather than what is both easy and glorious, to show mercy? Several, whatever they may call themselves, dispute Ashford's third comma on line 6, but not convincingly. A typical prayer would read, "Remember me, O Lord." However, and this is well articulated by Richard Stryer, a former student of mine who once sat where you are now sitting, although I dare say he was okay. In the May 1898 issue of Modern Philology, true believers ask to be remembered. However, the speaker of the sonnet asks God to forget. Where is the hyperactive intellect of the first section? Where are the histrionic outpourings of the second? The speaker sees his own sins in the inevitability of God's judgment, and he can think of but one thing to do: to disappear. Doctrine assures us that no sinner will go unforgiven, even if his sins are hyperactive intellect and overwrought dramatics. The speaker needs not fear God's wrath, but rather accept God's forgiveness. We want to correct them, to remind them of the assurance of salvation. But the encounter is over. We are left to our own consciences. Have we outwitted them, or have we been outwitted?
Miss Berry?
The poetry continues to state that
Miss Berry,
what?
you need to go down for another test.
No, we are done with the tests. I am busy with this.
I know, but Jason called. They're worried about a valve obstruction.
I said no, I'm busy.
Miss Berry, they want it now.
We promised no more tests.
I know, but it's not about procedure.
I said no more tests!
Miss Berry.
Name?
Dearinfg.
Oh, it'll just be a minute.
Time for your break.
Yeah.
Don't take your break. This is my play's last scene, and here heavens appoint my pilgrimage's last mile. And my race, idly yet quickly run, hath this last pace. My span's last inch, my minute's last point, and gluttonous death will instantly unjoint my body and soul. John Donne, 1609. I've always particularly liked that poem, in the abstract. Now I find the image of my minute's last point a little too, shall we say, pointed. I don't mean to complain, but I am becoming very sick. says it's time to begin aggressive pain management. It's the only way I'm going to be able to withstand it. I suppose the next line should be, it is such a relief to get back to my room after those infernal tests. No, it is a relief for a spring break cheerleader to go to Daytona Beach. Me getting back to my room after these tests is just the next thing that
Bearing, just want to check the I&O. See, 45, 65, okay. How are you feeling today? That's great, that's just great.
How are my fluids?
Pretty good, no kidney involvement yet, which is pretty amazing with Hex and Vin.
How will we know my kidneys are involved?
Lots of in, not much out.
That's simple, huh?
Oh, no way. Compromised kidney function is a highly complex reaction. I'm simplifying for you.
Thank you.
We're supposed to.
Bedside manner.
Yeah, I mean, there's this whole course on it at med school that's required. It's like just colossal waste of time for us researchers, you know?
I can imagine. Jason?
Huh?
Why cancer?
You mean why?
Well, why not open heart surgery?
Oh yeah, why not plummet? Why not run a lubrac for all the surgeons who know about Homo sapiens sapiens? Hey, cancer's the only thing I ever wanted. Really, I mean, cancer is
awesome.
Yes, that's right. Cancer is awesome. You know what? Like, how does it do it? These intercellular regulatory mechanisms, especially for proliferation, differentiation, the malignant neoplasm, they just don't get it, you know? Grow these normal cells in tissue culture in the lab and then replicate just enough to make a nice confluent monolayer and divide 20 times or 50 times, but eventually they just conk out, you know? Grow cancer cells, they just don't stop. No contact inhibition whatsoever. They just pile up, keep replicating forever, you know? That's got a funny name, you know what it is?
What?
Immortality in culture.
Sounds like a symposium.
Well, it's an error in judgment, molecular, you know? But why, you know? Even on the protistic level, normal cell-cell interactions are so subtle they'll take your breath away. Golden brown algae, for instance, you know, the simplest life form on Earth. You look at these guys, they're idiots. But it's incredible. It's, you know, it's perfect. So what's up with these cancer cells? You know, you got the smartest guys in the world with the best research labs and funding, and they just don't know what to make of it.
What do you think?
Me? Oh, I've got a couple of ideas I'm kicking around. Just wait till I get a lab of my own. If I can survive this.
The part with the people.
Yeah, well, you know, everybody's got to all the great researchers who want us to be able to converse intelligently with the clinicians, as though researchers were the impediments. These clinicians are just such troglodytes, you know, so smart. Like we have to hold hands to discuss creatine plants. What crap, I say.
What would you say? Do you ever miss people?
Everybody asks that, especially the girls.
What do you say?
I mean, I tell them, yes.
Do they believe you?
Some.
Some. What do you say if a patient is apprehensive frightened.
Of who?
Never mind.
Professor Gray? Do you know who the President of the United States is?
I'm fine.
I could order a test.
No more tests.
Tracing
No.
short-term
No.
memory loss.
No, I'm fine. Thank you. I'm just a bit tired.
Okay, look, I gotta go. Just keep pushing the fluids. Try for 2,000 a day, okay?
To use your word, okay. So the young doctor, like the senior scholar, prefers research to humanity. At the same time, the senior scholar, in her pathetic state as a simpering victim, now wishes the young doctor would take more interest in personal contact. I suppose now we shall see through a series of flashbacks how the senior scholar refused her students the touch of kindness she now seeks. You. How would you characterize the animating force of this sonnet? I'll give you a hint. It has nothing to do with football. What propels the sonnet? What was I to do? Did I tell him, "You're so young. You don't know a sonnet from a steak sandwich." By no means. You can either come to my class prepared, or you can withdraw yourself from this class, this department, and this university. Do not think for a moment that I will accept anything in between. I was teaching him a lesson. Now this is another instance where we would see Dunn's adverb at work. Not addressing the question, but rather reveling in its complexity. Yes.
But why?
Why what?
Why does Dunn make everything so complicated? Really, why?
Every term a student asked me that question, and it was always the smart ones. What was I to say? Why do you think?
I think it's like he's hiding. I think he's really confused. I don't know, maybe he's scared, so he hides behind his complicated stuff. Hides behind his wit.
Hides behind wit.
Yeah, I mean, if it's something he's really sure of, he could say it more simply. He doesn't have to make it such a big deal. He doesn't have to be such a brain or such a performer.
Perhaps he is suspicious of simplicity.
Perhaps, but that's pretty stupid.
Despite this observation's infelicitous pronunciation, I can see it was containing the spark of a perspicacious remark. This unusual occurrence left me with two options. I could either let the brain rest up to that heroic effort, or I could push on. I could either risk undergraduate banality or great human insight. I could never predict which one was to come. Go on.
Well, if he's trying to figure out the meaning of life and God and big stuff like that, Why does he keep running away, you know?
So far, so good, although it is only so long until they begin to self-destruct.
It's like, the more you hide, the less, the more you're getting closer, although you don't know it, and the simple thing is there. Do you see what I mean?
I remember observing a witty little conversation after one of my lectures on pronunciation and scansion. The students were young and bright, and as they were leaving my classroom, they were conversing, laughing at the expense of 17th century poetry, at my expense. As you see here, we must take advantage of the modern pronunciation of the I-O-N endings, as in expansion. Our two souls, which are one, though I must go, endure not yet, of breach, but an expansion, a goal to err Vivian's feet. Thank you, that is all for today. You may pack up and leave.
Well, I hope I can get a knack of this pronunciation.
I hope I can survive this class and reach graduation.
That was a witty little conversation, I will admit. It contained the mental acuity I admired so much in Dunn. However, I could only appreciate the scholastic application of wit, not its spontaneous eruption.
Professor Barron, can I speak to you for a minute?
You may.
I need an extension on my paper.
Let me guess. Your grandmother died.
You knew.
I guess.
I have to go home.
Do what you must, but the papers do what it is due. I don't know. I look back on all these scenes and I feel so much lost. It was the graveyard shift. I could hear Susie on the halls. I wanted her to come and talk to me. I had to create a little emergency. Nothing too drastic. It worked.
Is there? Is that you giving at 4 in the morning? I'm sorry, it just gets secluded sometimes.
I was awake.
You were? What's the trouble, Susan?
I just keep thinking.
You do that too much, you get kind of confused.
No, I'm stuck in a quandary. I keep having these doubts.
What you're doing is very hard.
Hard things are what I like best.
It's not the same, is it? It's like it's out of your control.
I'm scared.
Oh, honey, of course you are.
don't know. I used to be so sure of myself.
And you're not sure anymore.
No, I'm not sure.
It's okay. It's alright. Would you like a tissue? Would you like a popsicle?
Yes, please.
I'll go get you one.
The epithelial cells in my GI tract have been killed by the chemotherapy. The popsicle is cold, it feels good, it is hydrating. For your information.
Thanks. When I was little, we used to get these from a man in a truck. He would come around and we'd all buy our popsicles and then sit on the curb and eat them. Pretty profound, huh?
It sounds nice.
Vivian, there's something we need to talk about that you need to think about.
My cancer is not being cured with this.
No.
They never expected it to be.
Well, they thought that the medicine would make the tumor get smaller, and it has gotten a lot smaller, except it's popped up in new places now. It was the best thing they had to give you, the strongest drugs, and it's helped Kelekian a lot with her research. But there just isn't a good treatment what you have yet for advanced ovarian. I'm sorry. They should have explained
I
it.
knew.
You did.
I read between the lines.
What she has to, no, I say this, but what you have to think about now is your code status. What you want them to do if your heart stops. You could be the flu, which means that if your heart stops, they'll call in a protein who will resuscitate you and take you to intensive care until you stabilize again. Or you could be do not resuscitate. So, if your heart stops, we'll just let it. You'll be DNR. It's your choice, and you can think about it. I just wanted to present both choices before placing your plate in here.
You don't agree with them?
Well, they like to save lives. So, anything's okay as long as life continues. It doesn't matter if you're hooked up to a million machines. Kelekian is a great researcher and everything, and with fellows like Jason, they're really smart. But they always want to know more things.
I always want to know more things.
Okay, then. You'll be full code. That's fine.
No.
Really, it's your choice.
No.
so if your heart stops, let it stop. Okay. I'll get Kelekian to put in order. Susie. Yes? You'll still take care of me, right? Of course you will. Don't you worry.
Well, that was certainly a maudlin display. Popsicles. Sweetheart. I can't believe my life has become so horrible. But it can be helped. We are discussing life and death, and not in the abstract either. We are discussing my life, and my death, and my brain is dulling. Susie's was never very sharp to begin with, and I can't conceive of any other Now is not the time for verbal swordplay, for unlikely flights of imagination, for wildly fleeting perspectives, for metaphysical conceit. Look away. And nothing could be worse than a detailed, scholarly analysis, erudition, interpretation, complication. Now is a time for simplicity. Now is a time for, dare I say it, kindness. No, I thought being extremely smart would take care. It seems I have been found out. I want to explain how it feels. I want to use my words. It's like I'm a student. And it's the final examination. I don't know what to put down. Because I don't understand the question and I'm running out of time. Susie is stressing with aggressive pain management. She says I will really need it now to be able to withstand it. Such a little word. I think it here signifies staying alive. I apologize in advance what this palliative treatment modality does to the coherence of my friend's last scene. It can't be helped. They need to do something. Say it, Vivian. It hurts like hell. It really does. How? How are you feeling today? These are the last coherent lines of my life. Suppose I'll have to leave the action to the professionals. It came so quickly after taking so long. Not even time for a proper conclusion. And death, capital D, shall be no more. Semicolon. Death, capital D, thou shalt die. Exclamation. I'm sorry. I trust this will have a soporific effect.
Well, I don't know about that, but sure makes you sleepy. So funny.
Just that soporific means makes you sleepy.
It does? Well, guess that was kind of dumb.
It was funny.
I guess so. In a dumb sort of way. I never would have guessed it. I'm glad you told me. I'm a teacher.
Oh yeah, she was a great scholar. She wrote books, articles. She was like the head of everything. Pretty impressive. 275, 520. Let's up the hydration. She's not going to try anymore. I want to see if the kidneys can keep from fading. Yeah. Anyway, I had a lot of respect for her, which is more than I can say for the entire biochemistry course.
Do you want dextrose?
Give her sake. Yeah, she gave a hell of a lecture, you know. There's like no notes, not a word out of place, you know. Pretty impressive, but a lot of students hated her.
Why?
Well, she wasn't exactly a cupcake.
She hasn't exactly been a cupcake here either. Miss Barry, Jason and I are here, and we're going to be giving you some new medication. It's not going to hurt. Don't you worry.
Like she didn't hear you.
It's just nice to do.
Alright, 8 cycles of Hexaven, full dose. Well, you didn't think it was possible. You know, I wish they could all go through it at the full throttle. And then we could really have some data.
She's not what I expected her to be, you know? I thought someone who studied poetry would be sort of dreamy.
Not the way she taught it. It felt more like boot camp in English class. You know, this guy, John Dunn, was like incredibly intense. You know, like your whole brain had to be in knots before you could get it.
He made it hard on purpose.
Yeah, well, you know, it has to do with the subject, these holy sonnets. You know? This term that I think sums it up pretty well. It's called salvation anxiety. I actually came up with it myself. This is one of my favorites. I think it's pretty brilliant. You know? Salvation anxiety. I mean, you're this bright man, I mean, really bright. I'm talking like this guy made Shakespeare sound like a Hallmark, you know? Like, and you know you're a sinner, but this promise of salvation, this whole religious thing, you just can't reconcile it. You know?
Okay.
Well, it just doesn't stand up to scrutiny. You know? You can't face life without it either. So you end up writing these really screwed up songs. Everything is so brilliantly complicated. It's like tricky stuff bouncing off the walls like a game, but it just makes the puzzle so complicated.
So what happens in the end?
And what?
To John Donne. Does he ever get it?
And what?
His salvation anxiety? Does he ever understand?
Oh, no way. I mean, the puzzle just ends up taking over, you know? You're not even really trying to solve it. It's fascinating stuff, really. Great training for lab research, you know? Looking at things in increasing levels of complexity.
Until what?
What do you mean?
When does it end? Don't you get to solve the puzzle?
No. When it comes down to it, you know, research is just trying to quantify the complication of the puzzle.
But you help people. You save lives.
Yeah, I saved some guy's life, and the next day the poor slob gets hit by a bus. You know?
Yeah, I guess. I just don't see it that way. Guess you can tell I never took a course in 17th century poetry.
Yeah, well, listen, if there's one thing we learned in 17th century poetry, it's that we can forget about this sentimental garbage, you know? Enzyme kinetics was more poetic than her class was. Besides, you can't just sit around thinking about that meaning of life garbage all day. We'll go insane.
Do you believe in it?
You know what?
I don't know. The meaning of life garbage.
What did they teach you in nursing school?
Yeah, she's out of it. Shouldn't be too long now. Just, you done here?
Yeah, I'll just tidy up.
Alright, see you.
Bye, James. Vivian. It's me, Evelyn. Vivian? Can I get a chair? I'm in town visiting my great-grandson for his 5th birthday. I've been walking all over town. I found how early it is chilly here. I know you feel bad. Let me see. There. It's a windy day. Don't worry, dear. Let's see. Shall I recite to you? Would you like that? I'll recite something by Don. Oh. Very well. Little Jackie is very sweet. Gets into everything. Tale of the Runaway Bunnies by Margaret Wise Brown. Pictures by Clement Hurd. Copyright 1942. First Harvard Trophy Edition, 1972. Now, once there was a little bunny who wanted to run away. So he said to his mother, I am running away. If you run away, said his mother, I will run after you, for you are my little bunny. If you run after me, said the bunny, I will become a fish in a trout stream, and I will swim away from you. If you become a fish in a trout stream, said his mother, I will become a fisherman, and I will fish for you. Look at that. A little allegory of the soul. No matter where it hides, God will find it. See, Vivian? If you become a fisherman, said the mother bunny, I will become a bird and I will fly away from you. If you become a bird and fly away from me, said the mother bunny, I will become the tree that you come home to. Very clever. Shucks, said the little bunny. I might just as well stay here and be your little bunny. And he did. Have a care, said the mother bunny. Very nice. range will soon be to that island.
Alright, 3 p.m. Let's see. Number 707. Hydration totals 3,000 in, 400. Wait a second. Kidneys are. Wait a second. Oh, Jesus Christ! Get a code! Hello, Dr. Posner, Posner, room 707. I need a code blue, 4949. Code blue, get the fuck over here!
What are you doing?
I'm trying to save her!
She's no good!
She's research!
Jason, you saw Kelekian put the order in! You were there! I got the code!
Everybody out of the way!
Here! Patient is no code!
Come on.
Patient
Let's
is
get
no
ready to
code!
shock.
What do you have?
No pulse, no pulse. Come on. Let's get ready.
Patient is
And
no code! Shock!
hit her.
Clear!
I made a mistake!
Patient is no code!
Who the hell are you?
Monahan, my readers!
Let me see the goddamn chart. Where is it?
Should you stop?
What's going on? Oh, do not resuscitate. Kelekian. Shit. Order was put in yesterday. What is he, a resident?
Got us up here on the DNR.
Called him